cubital tunnel syndrome, median nerve compression, carpal tunnel compression, tunnel of Guillain, low back pain, herniated disc, degenerated disc, degenerated hips and knees. So you have muscles out of 2,300, probably 2,600 studies that I looked into. These are the basic causes that they say of thoracic outlet syndrome. Supercontractions, that's the majority of them in my opinion. Something growing into the outlet, like a tumor. If you have a Pancoast tumor, you're just hoping you're surviving. And the thoracic outlet syndrome is secondary. And if you have like any other kind of tumor, you're just hoping that like stringomyelia. Oh no, I can't tell you. It just really upsets me a great deal. I had a young 18-year-old girl came in with the inability to hold her cell phone with such weakness in the grip strength that she had numbness down both arms, and she had a backpack and a cell phone, texting all day long, and typical teenager. And she came to me, her father said, "Help my daughter, help my daughter." I said, "Okay." So what happened was there was a secondary outside review company, I'm not going to mention any names, in New York City that was reviewing all my claims for the city of Chicago. So I sent in the paperwork because it started January 1st, but I worked on her like December 25th. Okay? And so she had like a 9 out of 10, an 8 out of 10 on all these different symptoms and the weakness. And so when I sent the paperwork to him, by that time she was like a 5 and a 6. Okay? And she was having some strength improvement. So he gave me 2 visits at a time. And I said, "What's going on? I got to get 2 visits and then wait 4 days for your approval. 2 more visits, the patient getting frustrated, angry. And I'm not too happy either." And he goes, "Well," I said, "What gives?" He goes, "Well, I think it could be a stringomyelia." I said, "Really? Why is that?" "Because of symptoms and signs." I said, "Well, what about the improvement?" "Well, yeah, there's improvement." I said, "Well, you say I can treat cancer? I can cure cancer? Is that what you're saying? Because that's a cancer, right? Of the spinal cord?" He says, "Well, yeah, I forgot about that." It's like, hey, if you know the science, you can catch them on it and say, "Hey, what's going on? What are you talking about? You say I cure cancer? If it's a stringomyelia, it would not improve with the treatments I'm giving, would it?" "No, of course not." "Okay, so give me the visits." "Okay, 10 visits. Thank you very much. I just wrote the book on it, okay? I know this is cold, and I caught him, and that's how you have to be." So something that grows in the outlet, cervical ribs, and out. Okay, this really burns me up too. You get an x-ray back from a medical physician or an orthopedic doctor, and there's a cervical ribs, okay? So you're looking at it and say, well, that could be the cause. It seems odd, logical. But the patient hasn't had symptoms, and they're 30 years old, and all of a sudden they develop this numbness down the right arm. What happened? Where did the rib just grew out of nowhere? It's like the patient's had that for 30 years, no symptoms. It's just that muscle is the only thing that moved, compressed that outlet, and then that cervical rib is just an incidental finding. It has nothing to do with it. It just maybe alters your adjustment technique and where you're going to do your deep tissue, because you have some other tissue that you didn't have in a normal patient. But it really, you just have to treat it like a regular patient. Traumatic shift, like when you have a car accident or a work injury. So these muscle contractions. Okay, so here's what happens. This is the latest, by the way, in order to figure out trigger point therapy and how these muscle spasms develop, I read about 650, maybe 700 articles to get the straight information. And this is through PubMed. So it says here that for what happens is that you have electrical signal to the nerve, dump the acetylcholine on the muscle, cause a contraction. So if you have a constant contraction, if I hold the cell phone here for like 10 minutes as I'm browsing and texting my BFF and all that, then my arms start getting numb and I get tension. That's because I held it there so long that accordingly the muscle contracted. You got to contract it and relax it to let the blood flow back in. Contract, squeeze the blood out, relax it, let the blood flow back in. That's called exercise. But this is not exercise. holding it here for 10, 15 minutes. Contract it, squeeze the blood out, and it doesn't go back in. So now you've gone from anaerobic metabolism, or aerobic metabolism with oxygen transfer, to anaerobic metabolism, and you have the release of lactic acid. So the pH of the tissue actually goes from a 7 to like a 4. It actually happens. They measure the pH of the tissue, put a needle in there where the trigger point is, and they found that it was a 4, the pH. So, I mean, I'm not just flying from the hip. I read the research, and then what they said was possible that acetylcholinesterase, which is the enzyme that breaks up the acetylcholine, doesn't function in an acidic environment. So when the acetylcholine is dumped on the muscle, it contracts, and it constantly contracts because there's no enzyme to take away the acetylcholine. So it just constantly contracts. That's this muscle spasm, the trigger point. The second component of this is that you have inflammation, because when the muscle contracts constantly, you have this damage or breakdown of the tissue, and then there's inflammation. Cytokines. I did 3 lectures on the connection between cytokine or inflammation and depression, anxiety. At medical conferences in Melbourne, Australia, in Thailand, and in Malaysia, in Long Beach, California, and read about 30,000 pages of research to figure that out. But there's a direct connection between moods and inflammation, because when they say that people who are depressed, they actually, I just lectured in Las Vegas at this conference as well. People who are depressed, they don't want to talk to anyone. They don't want to do math calculations. Don't want to listen to lectures by Dr. Stoxen, and they just want to stay home. And people who have colds, like the flu, they don't want to do math problems. They don't want to talk to anyone. And they say that's called sickness syndrome. That's what that is. There's a name for it. And it so closely mimics depression that they feel that inflammation is connected to depression. And therefore, they've been doing some studies and finding, in fact, people with depression have high levels of inflammation as opposed to normal study patients. And this has been ongoing. So that's why, fish oil and things like that are effective that you can use it, and you can also do treatments for inflammation, full body inflammation. I was in I was in Melbourne, Australia, and I said to this man, he says, well, tell me about this low-grade inflammation and how you find it. And I said, you have low-grade inflammation in your right side of your body. He goes, no, I don't. And I said, yes, you do. Because I did a gait study on him when he walked up to me, and he had an overpronation of his right foot. Okay? So I was way ahead of the game. Okay? So I set him on the table, and then I found tibialis posterior, the ones that, the muscles, I know them. The muscles that kick in when you have overpronation are, medial arch, the tibialis posterior, TFL, gluteus medius. And he doesn't, because he's a scientist. He studies Alzheimer's biochemical. And he's like, well, where's the information come from? It's a mystery. And I said, it's not a mystery. Lay on the table. Put my thumb into his gluteus medius. Shot through the roof. Ah, Jesus Christ. Push real hard. Push real hard on the other side, nothing. TFL. Other side, nothing. Okay, there's your inflammation. Goes, oh my God. And they've been studying this for 25 years. Alzheimer's in birth. It's like, bing, the light bulb goes on. I go, what are you doing for it now? We're giving them turmeric. You give them turmeric until you're blue in the face. You are not going to, the whole side of your body is full of inflammation, soaking it. And you're giving them turmeric, you're wasting your time. You're going to, you're just a waste of time. You have to get down, or fix it, put the shoe on, foot, whatever you do, fix it for nature. That's how you do it. So, when you have this inflammation, it's from like whiplash, or here we got muscle contractions, state overloading, like a 9-pound bowling ball. You get a patient, get a bowling ball weighs 9 pounds, put it in your office, put it on a little pestle, say, okay, now you sit like this, all right, this is your, by the way, this is your head. Boom, and you put it in their lap, and they go, oh my God, that's heavy. That's how much your head weighs. Wow, that's like, bing, the light bulb goes on again, okay? And they go, when you lay like this, then you're dangling a 9-pound bowling ball from your neck. Just hold that for a while. Yeah, can you put it down now? Can I put it down now? No. How long do you watch TV for? 30 minutes. Okay, in 30 minutes you can put it down. Now you know where your neck pain is coming from? Yeah, it's pretty simple. Because you know why? You give them all this deep tissue, and you adjust their neck, and they go home and they lay on the lazy boy, dangling a 9-pound bowling ball from their neck. And they blame you for the reason why they didn't get better. Forget that. Listen, I got a reputation in my area. I am not going to be blamed for you, sabotaging this perfect treatment. And I hope you understand that. So, there's an 8-year-old daughter right there, okay? I'm going to give you $5 for every photograph you take of your mother laying in bed watching TV. Oh, really? You bet. And here's the first $5 as a down payment. And I give her $5. And I said, if you get your mom on the cell phone like this, I'll give you $2. And I put the kid to work. And you know what? She's all over that. Taking pictures. I caught her right here. Shut up! Don't do that. Misbehaving with the doctor. This is sustained contraction in the bed. Obviously, we're going to use some pillows for that. And what we could do is we can actually tell them to put a mirror next to the bed, and look in the mirror to see how they're really sleeping. Because I noticed that when I was laying in bed, I thought I had a good pillow, and I looked into this black lacquer cabinet, and I saw my reflection. I said, "Oh, no wonder I'm not feeling good on my neck." And then I corrected it. But you don't know because you've got to take a picture of it. Here we got sustained contraction from remote, cell phone, you name it. Find out what they do that causes it. Because if you get them, you do all this work on them, and they sabotage it, then you're just like, oh my God, this is the cell phone and the all of the above, I call it. This is like, she got her bag, and you know what? They come in with these bags, you ladies. What's up with that? What is this? Oh, no, it's actually light. It's very stylish. It doesn't match my outfit. It's pretty slim. You guys pay $1,000 for that. I think women think that men look at the bag.
That's a beautiful bag.
She's hot.
That's a beautiful bag.
It is a beautiful bag. But, men aren't looking at the bag. But, women look at the bag. So that bag she's got. And then they hate you. She's got money, I don't like her. No. But, when the bag's got, you know what they got in the bag? They got their cell phone, a charger, and they got, what else? You got to have a bottle of water. In case you end up in the desert, that's something you got to have. You got to have that water, because if you end up in this, just drift off of Chicago, and you end up in the desert. And you kind of joke around with them, what's that bag? Let me see that bag. Yeah, I see that? Oh yeah. That's an 8-pound bag. Okay. Now all right, here's what happens. You got the bag on the right hand, and the head is the only weight that we can shift to counterbalance the weight. So what we do is hold it here, and we shift it to the side like this, and we walk around like this for 6 hours a day, wondering why our neck hurts on the left when we hold the bag on the right. We've got compression here. Okay, this is a case that really freaks me out. This is a great case. I don't know if you know Kevin Trudeau. Do you know Kevin? Obviously he's in a different spot. Unfortunately, he was put in jail, Kevin. But he was a patient of mine for 8 years. I can't really treat him in jail because he's in jail. But anyway, what happened was his wife, very beautiful Russian lady, she recommended her tennis instructor to come to see me because they were going to do surgery on his neck. So she was adamant about it, so he came to see me, and he was about 35 years old. His girlfriend was with him, probably to determine whether or not he was able to keep making money and income, because he wasn't able to play tennis anymore. The doctors told him after the surgery his tennis career is over because you're going to do a fusion. His sister was an MD, and her husband, they referred him to 3 surgeons for consultation. It's like, well, you go to the shoe store, you got to get a pair of shoes, you go to surgery, get surgery, but you can't explain anything to the man because it was his sister who referred him, so he's like, well, my sister, and I don't believe you, anything you say. And so what I did was I did the test, and I said, this guy's got a thoracic outlet syndrome. He had screaming pain down his right arm. So he's arguing with me, and I said, well, why are you arguing with me? He says, I said, look at the calcium deposit, herniated disc. I said, there's calcium deposits all over that. That means it's been there for like 25 years. So that's not the cause. And you'd have a trauma. How can you get a herniated disc when you had no trauma? You know? And he says, well, and he's a tennis instructor, so I said, 6 weeks ago, did you do anything different? I got this new ball thrower that you have to, I drag it out, I said, oh, yeah, that's nice. And then so I figured out what he was doing. He grabbed a hold of his ball thrower and he's dragging it out to the tennis court, and it's on the left side. That's how he got the thoracic outlet syndrome. So I said, he says, well, I don't believe it. I said, well, why are we arguing about this? Let's just go do the work. So that was 8 o'clock at night, okay? Now, 12:30 in the morning that day, after I went through twice to prove to him, because Kevin referred him, and got to knock this thing out of the park, you know what I mean? And so I did that first rib adjustment, and you know when you got it, it's like, boom, everything went into place, man. It was just like a big release. And I go, all right, you're going to be fine. He got up and he goes, my pain is completely gone. But it's going to come back. I said, no, it's not. So the next day he comes in, he's mad at me. And he says, I'm so, not mad, he's mad, not mad at me. He says, I'm mad. I said, why is that? He said, well, I was on the way over to your office and they heard. I said, I know about that doctor. He's talking to a neurosurgeon. He goes, oh, he's going to help, maybe help you for a few days, but then it'll come back. That's where he got the come back thing, you know. He's on the way to my office saying he's going to chiropractic, Dr. Stoxen, and he goes, oh, let's do the surgery tomorrow, not Tuesday. That's what they said. Let's do it tomorrow. He says, so he would have had surgery that day. So he says, I'm so angry. I said, my sister referred me to these orthopedic surgeons. I thought I could trust her. So that's what happens. So that's the body lean, the head lean, and then you got that, okay? Repetitive motion, keyboard, mouse. Say like 20 minutes on the mouse, and you've got a trigger point. That's what the science tells us. 20 minutes is all it takes. And motor vehicle accidents, the history, mostly numbness and burning pain in the limbs, and the activities of daily living is where you can get this too, like when you're doing the history. Say, what do you do for a living? Do you watch TV in bed? Do you read in bed? Do you have a lazy boy chair? Do you sit on a chair? Do you sit on a couch? How much time do you watch television? How much time do you use the mouse? Those are the questions you ask in history. You have to determine all that. Because if you don't, then you can't make the causal connection. So abnormal muscle weakness are the other that will cause structural changes are weakness in the muscle, like this weakness, okay, of the back muscles. This is an over-exaggeration, obviously, or muscle tension from the reflex that comes from the nociceptor reaction, and spindle cell strain gauges. And so you have, these are the muscles that are involved. And as you can see, the bicep, you know what's so crazy? When we talk about the pectoralis minor, they cut it, right? Because they say the pec minor pulls on the coracoid, drags the shoulder girdle into the thoracic outlet, all right? And it's so stupid. Because the coracobrachialis muscle that does this also does that. Did you know that? They're all connected there. And so is the bicep short head. That does this. The bicep short head. Coracobrachialis does this. Pec minor locks the shoulder down so that you can get your arm extended, you know, as a stable platform. So why are you only cutting one muscle? I don't understand that. That's really stupid. You know that this is a more effective treatment to treat the coracobrachialis and also, of course, the bicep short head. And there's ways that we can get underneath to get those. So manual muscle testing, we test these muscles to see, you know how to do it, you know, like this, and muscle test, extension, all of those muscles. You have to find a way to check them, try to isolate them, and then we do adsense test where we actually push down to the shoulder to, compress the outlet, and then bring the arm back, kind of turn the head to the side, twist the scalene muscles around the artery and the nerves. The vein comes out in front of the scalene muscles, actually. It's in a different area, but it does eventually combine as it goes through the tunnel. But in the scalene area, the vein is not affected. So that's how you take the pulse, and then if you feel the pulse go away, then you feel that you have a possible thoracic outlet syndrome. They say, well, there's positives, false negatives. You know what, I don't care, you know. I've got something there that I want, I'm looking into here. You know, whether it's false positives, all that. We're not here to name things, we're here to take care of the patient. So I don't want to hear about that false positive, false negative. I'm going to move the shoulder here, maybe I'm going to do this. Maybe I'm just going to push down first. And then I'm going to take the pulse just by pushing the shoulder down. You know why? Because that doesn't affect the scaling muscles. So I know if I just put the shoulder down and if I have a numbing or the decrease in the pulse, that it's coming from the compression of the clavicle on the chest area or the costoplavicular area. And then if you push it down, it doesn't affect the pec minor because it actually shortens. So it's the costoplavicular area. If I just push the shoulder down initially, when I roll the arm back, now we're tractioning the pec minor across the chest. So now if it goes away, it starts to lose the pulse there, we know it's pec minor. So just by manipulating the body like we know it so well, we can find out a lot more than just doing a test of positive or negative, you know? So use your brain and try to figure out how this thing works. And then you'll be able to get more information that will actually help you treat the patient. These are the tests that you use. This is Rue's test where you have them hold their arms up like this and then you do all these grips like this to stimulate blood flow in the arms, and if it goes away, then, or if you end up with numbness, then you actually have a positive Rue's test for 3 minutes. And then you have the hyperabduction maneuver where you're taking the pulse and hold the arm up like this, and as you can see, you're checking where the neurovascular bundle traverses underneath the pectoralis minor muscle. A Syriax test, just go behind them and lift up their shoulders to take the pressure off the outlet, and if the symptoms go away, it's a positive test. And then the diagnostic tests, when are these tests indicated? You know, if it's persistent 2 weeks, or when do we do a test? Sometimes you do it right away. Do you know that 30% of the population that have never had pain in their back in their whole life have a herniated disc? Did you know that? Do you know that 20% of patients that have never had neck pain in their entire life have a herniated disc in their neck? And 6% of them have been found to have not only a pinched nerve where the disc is herniated into the nerve IVF, but it's also impinging on the spinal cord. We want to know for sure what it is. It could mean something, it means nothing. Just because MRI says it's a herniated disc doesn't mean that's what the pain is coming from. So let's just put that aside. People come into it. Here's my life. They got 30 MRI scans. No, I'm kidding. Big piles of tests. So here's my life, okay? All right, let me put that over there. Okay, well, you're not going to look at it and stare at it like this. There's my disc, it's herniated. No. What I want you to do is stand over there, take your socks and shoes off, and I get out my little camera and I say, I want you to walk for me. And then he walks for me, and he walks like this. And the pain is on the right side. Okay, that's the problem right there. What? I said, a lot of people have herniated discs, yours is not healing. You got to fix that leg walk, fix that pronation, and then it'll heal. Oh wow, nobody ever explained to me that. Well, that's why you're not getting better. Okay, so what would say, why would they order these tests the first day without conservative care for 10 to 12 weeks? Why do they order the tests the first day? Because they don't have good field skills. That's one. They don't know how to examine patients anymore. Because you know why? They rely on the tests. Why do I need to learn how to examine anyone? Because I can just do the test. That's what the medical profession loves. They don't know what to look for. The test will show everything. At least they think that. They don't have any faith in conservative therapy. They're looking for something they can operate on. They were told by the hospital to do more tests. I don't know. That's just something that somebody told me. One time I was at this one function. It was a hospital for a hospital to raise money for this new surgery center. So there was like 400 people. We're all dancing, live band, blah, and the nun got up and said, "I want you to thank you all for coming." And then this girl knew about my work. She said, "We got to meet this doctor." And she said, "Let's sit down and talk." So I said, "This is how we do it, and we can save people from surgery."
Right.
And she goes, oh, okay. And I said, well, that may mean that you'll have about a $30 million reduction in your overhead, in your overall income. He goes, oh no, we can't have that. We need those surgeries to keep the hospital open. I don't think this is going to work for our program. And she let me go. She was all excited in the beginning, but if it didn't, if it took away the income from, and that's a nun, okay? What can I tell you? If the arm is purple or blue, and if you have a gray arm, it means the blood's not getting to it, you're in trouble, okay? You need to work fast. If you're going to try to do it conservatively, you better work fast to do that pain exorcism I told you about. Like some say, look, I'm going to cancel all my patients for this afternoon and tomorrow morning. And we're just going to go at this thing real fast and try to knock this thing out before you end up with surgery. And so what are some of the legitimate reasons for diagnostic testing? Progressive severe symptoms and severe pain requiring hospitalization, neurologic signs in the arms and the legs, and if there's a possible labral tear or rotator cuff tear, and or if there's a possible fracture and dislocation. So here's some of the other tests that they use. X-rays obviously is one that we can use. EMGs, NCVs are some of the ones that they use. CT, duplex scanning, MRI, pulse oximetry you can have in your own clinic. Less than $100, put it on the fingertip to measure the oxygenation of the blood. If there's a reduction, that means that there's not good oxygen getting to the extremity. It's cheap and actually pretty accurate. X-rays, straight reversal of the curve, degeneration of the neck, calcium deposits in the rib joints, vertebral junctions, and extra ribs, cervical ribs. NCV, most doctors like this test for neuro TOS, and that's the most common one, like 80% are neuro TOS. And then you have the vascular studies of angiography where you're actually seeing a obliteration of the subclavian vein, which means nothing, in my opinion. I just go ahead and do the decompression manually, and then we see it come right back again, majority of the time. I've never sent one patient to surgery yet. This one is showing a reduction in the blood flow through the subclavian artery, which is pretty severe. You're going to be looking at a limb that's gray, and here's the pulse oximetry. That's what it looks like. You can get one for a reasonable price and use it. This is the differential diagnosis: trauma, neck trauma, shoulder diagnosis, like hyperabduction syndrome, rotator cuff syndrome, shoulder impingement syndrome. These are some things that mimic thoracic outlet syndrome that you have to differentiate. Extremity compression, like carpal tunnel, tunnel guion, tunnel, cubital tunnel, medial nerve compression in the forearm, pronator syndrome. But the idea is that, one thing I noticed, they can have a lot of these things at the same time. If you're putting jars in a box all day long for 8 hours a day, you might have all these. You may have a carpal tunnel, a medial nerve compression, and hyperabduction and a thoracic outlet syndrome. That's called a quadruple crush. You got a double crush, triple crush, quadruple crush. Their whole body is like this. They walk in, they go, I don't know what's wrong with me. You're my scan. Yeah, you really got a problem. Okay? So you got to do some work on it. Neck trauma. This is it. 6, 7, T1. Cervical radiculopathy, thoracic disc injury, very uncommon, but they do have it. Cervical spondylosis, as you know. Clavicle injury, AC joint, shoulder impingement syndrome, rotator cuff syndrome, intercostal neuritis, and compressive neuropathy, like we talked about before, vascular compression, atherosclerosis, or Paget-Schroeder's, where you have a clot formation in the subclavian vein. That's a pretty serious problem. Tumors, like Ankos, spinal tumors like syringomyelia, oh boy, that was a good one, and cervical ribs and fibrous bands. What treatment alone does not work, and why? We went over that already. Gentle stretching, injections of the scalene. Obviously, we know that there are 8 muscles, not 2, that compress the outlet, so that's a waste. Botox. It seems like everybody in the medical profession reach for whatever's handy, right? oh, we got some Botox here, it's only meant for wrinkles, but let's inject it in your scaling muscles and then you have this miraculous recovery. But the bottom line is that obviously if you put an arm in a cast for 9 weeks, it looks pretty bad, the kid, you know, when he broke his arm and it's, oh, it's atrophy, weakness. You're talking about 6 months where they inject actually kill the nerve, obviously. For 6 months, the atrophy is so severe that the recovery through the rehab is like, you know, those muscles are important, you know. A scalene muscle right the head during various different reflexes throws a whole reflex system of the body off. You have to recruit other muscles to do the job of the muscles that you injected because they are needed. So that's just, it's, in my opinion, using Botox is just a, you know, it's a reckless treatment. It's a reckless treatment. And sometimes they do it in 5 minutes, they're already injecting the patient. Atrophy is quite severe. They don't know the ramifications, not explained to them. They just jump into it because, oh my God, take away the pain, what do I do, what do I do? Let's try this. So, are they effective? And these 3 studies say that they're not. They're done by medical professionals. When surgically is medically necessary, we went over that. The main was when the failure of a supervised physical therapy program does not work. And this is the reason. Ready? The problem was misdiagnosed from the start. The patient was underdiagnosed. You said that they had a thoracic outlet syndrome. When they had a thoracic outlet syndrome, hyperabduction, medial carpal tunnel, and pronator syndrome. And you only treated thoracic outlet. Still have numbness in the fingertips because you didn't go all the way down checking all the muscles and treating them, by the way. And also that they didn't focus on the 5 requirements to effective reversal. We'll go over that. And also, if you don't have the skill set or they don't have the funds, they don't have enough money. I can't afford this. This is the bottom. I said, okay, here's the surgical resection. Go underneath the armpit, find the scalene muscles, clip them, and remove the rib. First of all, this is what's required. Number 1, you have to erase the neuromotor pattern that's creating the spasm. We went over that. You have to get the oxygen in the tissue so that the anaerobic metabolism shut off the production of lactic acid so that the acetylcholinesterase can come in and remove the acetylcholine to stop the constant contraction. Number 2, you have to reestablish the joint plate of the bones, like the first rib, second rib, these shoulder joints are all locked up because of the compression from all the muscles of the shoulder by adjusting them. Are you happy now? Chiropractors very good at that, actually the best. So we are the best people for that job. So also we have to remove the inflammatory chemicals. I use vibratory massage. My people get 30 minutes of vibratory massage on all these muscles before they even see me. I want all those inflammatory chemicals that are soaking the muscles out of the body, and I want fresh, healthy, oxygenated blood replenishing the area to turn off that lactic acid response. And I need to get that oxygen in there to, like I said, to turn off the anaerobic and turn into aerobic metabolism. Plus, by using the vibratory massage, I can flush the inflammation out, and then that turns off the nociceptor response. So the activities of daily living has to improve. You know, you cannot watch TV in bed, and no, you cannot sit on a lazy boy, and no, you cannot read, and no, you cannot do this, let your arm hang out here for like 30 minutes while you're just reading something on the computer. Put it down. Okay, good. All right, that's what you have to take, and you have to be very adamant about it. And if they come in and they lean against the door like this, I say, look, you're tripping that thing again. That's your habit. Stop doing that, please. Okay, every second of the day you catch them in the office, like, sorry, you can't do that. You can't do that. You gotta stop. You gotta stack your body and teach them how to use posture to correct their posture. All right, I want you to show me good posture. You go like this. That's a learned behavior. That's causing compression, using muscles compressing the body. What you have to say is, all right, you have to say, what I want you to do is I want you to take this bowling ball, and it's sort of like a game that, you know, like you're balancing things that you stack up on top, like 30 things, you win the game, the other guy got 15. Okay, and you have to just let your body completely relax, to an equilibrium state and balance the head on top of the body. There. Now you got good equilibrium, balance of muscle tension, and completely relaxed with all the body parts stacked up with no muscles tensing to hold any part in any particular position against gravity. Got it? And then you teach them that. And that's what was it that was that guy who was works with musicians. The Alexander technique teaches that. So if you follow that, I think you'll be pretty good. This is the surgery, obviously, but then we went over the pec minor. And you see, let me show you that attachment again. You see, there's the pec minor, but there's the coracoid brachialis, and there's the biceps short head. So you have to work on that. So you lift the arm up like this, and you go up underneath the deltoid to catch those muscles, and then you can do deep tissue on them. This is Paget shoulder syndrome. Obviously, you can see the clot formation, and that clot formation, if it releases, it could cause some complications. Which one could be death, and the other one could be pulmonary emboli. So the idea is that we probably have had some of those, we didn't know it. But the bottom line is that you're going to put a catheter up in there, put the clot busters in, and then tell the patient, look, we do have to do that. But what we're going to do is we're not going to do the decompression. We're going to do it manually. So come back to me, and I'll do the rest from there. And then you follow up with them on that. These are the symptoms: paresthesia, cyanosis, and deep pain in the chest. And look at the arm is different color, edema, redness in the arm, cyanosis. When you've got that, you better get on that real quick. This is where you're getting the Paget shoulder syndrome, and they're getting this a lot of movement above the head and the shoulders. Baseball pitchers getting it. There's like probably 3 big-time pitchers that got thoracic syndrome surgery in the last year. One, it was I told you about, they got the surgery and then threw the no-hitter. So, these people, these young kids and the parents are like, well, you got it, you got through a no-hitter, maybe I'll throw a no-hitter. No, you can't even throw the ball at all. But they think that it's no big deal, It's no big deal. Just get, like he did, the pro ball players are really good. No, it's not like that. So, this is how it's diagnosed. Paget shoulder is not thoracic outlet syndrome. It is a condition that is caused from a worsening thoracic outlet syndrome. So the treatment is to put a catheter in, put the fibrolytic agent, which is clot-busting drug, and remove the astringent. And then after that, when the clot is gone, they see it's gone, then they do the surgery to excise the scalenes, the rib, and the pectoralis minor. That's called astringent compression. Then they will cut that vein and they will reconstruct it, the vascular surgeon, where that pressure was, called a vein patch angioplasty. And there's another, it's called a percutaneous angioplasty. So Pallades vein balloon angioplasty, where they put a balloon up there and open it up too. So those are the 3 ways that they open it up. So then they're in inpatient therapy for probably 3 to 12 weeks, about 3 months, 3-4 months after the operation. They should be okay. But of course, these are complications. What works: release the compression, strengthen the body, and train like a spring. You have to know the muscles where they are, and also you have to know how to get them, the super contractions directly under the thumb when you're doing your deep tissue. You got to apply the right depth of pressure. Now, this is a funny story. I had this attorney that came to me from Toronto, and he was off work for 2 years on disability. And he went to all the best doctors in Toronto, the Maple Leafs, all the big time guys. And he said, after I saw this video of you doing this lecture, I had to come to you. I said, okay, what happened? So we started doing the treatment. I'm doing the pressure, and I'm looking around about the middle part of the clavicle on the subclavius muscle. And I come about right here, and he goes, my arm's going up. My arm's going up. I said, yeah, that's kind of what happens when you go put pressure here. Okay. No, wait a minute. No, you're not understanding. The arm's up going up. I said, that's normal. And he said, well, that's not what they told me. They took the pressure off right when they got to that point. I said, do you know why they did that? No. Because you're an attorney. Oh. They got nervous, and they said, this guy's an attorney. They pulled the pressure off, and they didn't complete the treatment. So you know how many treatments he had? 186 treatments of no value to him. So you have to know the patterns of referred pain, when it's abnormal, when it's not. And you don't have to know what's good pain, what's not, and when it's completely released. Here's the facts, and I don't know how much time we got. You all right? Okay. This is the facts. I'm going to end it with this. Here's the subclavius muscle. It's about 5 inches. This is called the CUN in Chinese human inch. It's the thumb pad. We use that for our deep tissue. So the subclavius is about 4 inches long. So if you did 2 minutes of deep tissue, like hold it for 2 minutes, is it gone? Yeah, okay. What are you doing? You're resetting the spindle cells and you're pushing the inflammation out of the belly of the muscle. And then the flushing of the blood with the vibrational massage works it out of there so the nociceptors don't respond. And you go another 1 inch over, is it gone? Yes, okay. Is it gone? So you're talking 4 inches times 2, that's 8 minutes for just this little muscle. So you got it, subclavius, supraspinatus, middle scalene, pectoralis minor, anterior like. That's like 44 inches of real estate. If it's 3 minutes, it's 132 minutes to go through one treatment. 264 minutes is on left and right side. That's 264 minutes. That's 6 hours. Got a real bad case. So that's why the treatments can last 25, 30 hours. Okay? I don't make the rules. I just do what I know has to be done. I can't help it if your insurance only covers 15 minutes of deep tissue. This is what you need. This is what is required. And we actually had a radio show, and BFM said, pain exorcism, what's this all about? That's that treatment I was telling you about. I don't know if you read the book by Anthony Field, about 2012. Anthony Field from the Wiggles was the spokesperson for the Chiropractic Foundation for Chiropractic Progress, the Wiggle guy, and he went on TV and talked about it, CNN and all that. Not many people know this, but that patient, he was 25 years of chronic pains, clinical depression, and he was suicidal. That treatment was completed in 1 weekend. And so I was able to reverse 25 years of chronic pain to the point where he was so blown away by it, he wrote a book. It was published by Wiley and HarperCollins about how I got my wiggle back. But that was done in 1 weekend. And so it can be done, and he hasn't had the pain recur since then. So with that, I wanted to thank you very much for inviting me here to talk about thoracic outlet syndrome.